Car racing, aviation, aerospace, and healthcare are similar. They continually push their limits in a high-risk environment. A safety net of invisible threads protects them. When those threads stretch, break, or are cut, accidents happen, ripping the joy of our loved ones from our lives.
I'll never forget your daughter. She's in my heart and in my dreams. I'm really sorry, and I hope you can someday forgive me.
We don't have bad people. We have bad systems. The good news is we can fix them.
Racing and aviation differ from healthcare because they saw great danger coming and learned hard lessons written in blood. It was their tsunami. The deaths of Formula One and NASCAR champions shocked their industries. These tragedies drove them to innovate new safety practices and designs. The result, a dramatic drop in fatalities and harm. As airline flights increased, the industry predicted one crash a week. Clearly unsustainable. They had to change. The miracle landing on the Hudson is a testimony both to visible heroism and an invisible safety net.
We have plenty of evidence to tell us that our hospitals and healthcare delivery is not safe enough. And what we're really looking for is leadership to make that happen.
I'm Dr. Charles Denham, chairman of TMIT, a global healthcare research organization. This documentary is about you, your family, your hospital. A danger wave is upon us. But the good news is that tomorrow's heroes in healthcare are in our hospital boardrooms today. They just don't know it.
Movie star Dennis Quaid became a patient safety champion after a hospital accident almost killed his newborn twins.
A nurse unintentionally gave our children 1,000 times the dosage of a dangerous blood thinner called heparin. And our babies could have died that night. I'm pleased to report that the twins are doing fine. I firmly believe that this was due to a lot of praying by a lot of people who heard about our twins' plight in the media. Through these precious children and their story was the opportunity to turn lemons into lemonade by helping prevent something similar happening to someone else's kids or loved ones. 100,000 deaths occur each year in this country due to healthcare harm. Now that's the equivalent of more than 10 747 jumbo jets going down each and every week. And when you add infections into the mix that people get in hospitals, it doubles that number. That means that now 20 jumbo jets are going down a week, making healthcare harm the third leading cause of death in America.
A global danger wave of harm and waste can bring down even our most powerful nations. We can't ignore the warnings, and we must learn from other industries.
And the good news is that the real sweet spot or safety envelope for high-performance care is the intersection of three systems: leadership, safe practices, and technology. When these support systems are functioning within the right organizational culture, we get great care and we get safe care. Thank you.
Thanks to Dennis Quaid and leading experts, Chasing Zero, a documentary and toolbox were created. They're being put to work around the world in hospitals, medical schools, and even in communities by patients and families building awareness. It was filmed around the globe, in Geneva, London, and at some of our greatest hospitals, including the Brigham and Women's Hospital, the Cleveland Clinic, Vanderbilt Medical Center, Johns Hopkins, and the Mayo Clinic. And even on a movie set in Hawaii. In Chasing Zero, Hospital accidents focus the lens on heroes doing great things, role models to inspire others to act. These are the faces of hospital accidents. They're not statistics. It's easy to get buried in the numbers until you have to bury your son, or your daughter, your wife, or your husband.
We can fix our safety net and prevent needless hospital deaths and harm through our hospital boards. There are future heroes of healthcare. They just don't know it.
We surveyed over 1,000 hospitals across the country. And when you look at the bottom performing, the worst performing hospitals in America, not a single board chair from any of those hospitals, not one, thought they were below average. Most thought they were better than average. A few thought they were about average, but not a single one thought they were below average. And it's a level of denial and a lack of knowledge about their own performance that I think is shocking.
When we found out how the quality of care in our hospitals had slipped, we were shocked. And as a trustee, it is our job to apply the resources that we have to bring the quality back to the level that we all expect and deserve.
Ground zero is the boardroom and the senior management.
The board is ultimately responsible for the overall performance of the organization. Safety and quality is a huge part of that responsibility.
As a trustee, many times we often forget and don't understand that we're responsible for those invisible systems that can make all the difference between life and death within patient safety.
Julie Tao, a nurse involved in the accidental death of a young mother, and pharmacist Eric Kropp are part of a growing group of caregivers who've been criminally indicted for hospital accidents. Very predictable, system-driven mistakes. Eric was incarcerated for the death of a little girl, Emily Jerry, who died of a lethal injection of a salt solution during her cancer treatment.
If I had a chance to make amends and talk with Mrs. Jerry, the first thing I would tell her is I am so deeply sorry that what has happened with Emily. I never intentionally or tried to hurt her daughter. I wish I was in her place, because I'll never forget your daughter. She's in my heart, in my dreams. I'm really sorry, and I hope you can someday forgive me. Thanks.
Well, I think the criminalization is a terrible thing. And in every case, there were obvious explanations for why the mistake happened. And those explanations all have to do with the systems they were working in and the institutions that were responsible for those situations.
What was Emily like as a little girl?
She could light up a room when she walked in. Emily could always put a smile on your face, always. My heart sank because I knew that she had to have just gone through so much pain. It wasn't like she was overdosed on an opiate where she would just go to sleep.
So you felt
it had to be very, very painful for her. And I think that was the toughest thing to deal with, Chuck, was knowing how much pain she was in.
Careful research has shown that about 95% of all harm to patients, all patient injuries, happen at a systems level. Only about 5% is human error.
But what are these systems? What are the threads of the safety net that would have saved Emily Jerry's life? In this world of 10-second sound bites and 24-hour news cycles, it's virtually impossible to explain hospital accidents and the safety net failures, and especially why the responsibility, in fact, the accountability, lies on the shoulders of those in the boardroom. It's much easier to make a caregiver or a hospital the bad guy, the villain. In interviews after the premiere of Chasing Zero, it was very hard to address the cause, that it's not bad people, it's bad systems.
Is it all right to send the message out through Dennis and you that you've got to be very skeptical of every doctor and every nurse? You don't want to get in the way of what they're doing, but you just can't take their word for it anymore, can you?
Well, really, we don't have bad people, we have bad systems. The complexity of care has gotten so great that they're doing a magnificent job, and that's what's so great about Dennis being inside the system now and understanding good people but bad systems.
Dennis Quaid and Dr. Denham, thank you very much. We appreciate you being on the show.
Guys, thanks a lot. We appreciate it.
We are clear.
We could not get the message across in just a few seconds. TV producers, consumers, and even hospital executives and boards glaze over and think we're speaking jargon. We have to use metaphors and humor to explain the invisible safety net.
All right, girls, now this is your last chance. If one piece of candy gets past you and into the packing room unwrapped, you're fired.
Yes, ma'am.
Let her roll!
This classic Lucy sequence captures the very essence of the vulnerabilities of a stretched workforce and the importance of the invisible safety net.
Here she comes.
Fine, you're doing splendidly. Speed it up a little!
Nurses cringe when they see this manager. It sounds all too familiar. But when we stretch the limits of our workforce, we lose a lot more than just chocolates. The global crisis of harm and waste is striking industrialized and emerging nations alike.
If any of you were admitted to hospital tomorrow in any of the countries of the world, in the Western Europe, in North America, in Australia, your chances of being subjected to an error in your care would be something like 1 in 10. Your chances of dying due to an error in healthcare would be 1 in 300. Compare that to air travel, where your chances of dying these days in an air crash would be something like 1 in 10 million.
These countries represented around the world all have key issues, whether they're underdeveloped or whether they're developed countries. Is that a fair statement?
That is a fair statement, and I think new innovations need to be globalized, not only because of the market, but also because the need of patients, and patients have the right to have access to high quality care wherever they live. And that's the reason why the help of WHO here in Geneva is so important.
The crisis of harm and waste has made quality a requirement for payment by insurers. No one wants to pay for accidents anymore. This no outcome, no income tsunami is blindsiding hospitals. In a series of articles, we warned that the cost containment mantra of no margin, no mission of hospital leaders would be replaced by a market demand of no outcome, no income. We predicted hospitals would be surfers, swimmers, or sinkers. The surfers will leverage the power of the wave and build a platform and thrive. The swimmers will capsize and barely survive to watch what happens, and the sinkers will drown and wonder what happened. More than revenues are at risk, seniors and children are the most vulnerable to healthcare harm. The waste is shocking and unsustainable. Distrust is the silent killer. A study of 600,000 staff in 1,100 hospitals is a frightening story of distrust. They're afraid to report errors while they're happening. Distrust in government, banking, and business concerns us. However, the distrust of hospital leaders by their staff spells the difference between life and death. Best-selling author Jim Collins helps leaders understand the importance of awareness and management of risk in his groundbreaking books.
If you think about any great complex system, it's a challenge or launch decision in a certain way almost every day. It usually starts to be, well, we've gotten a little comfortable here, we went out and it was fine at this time, so we'll go a little further, it was fine at this time, it will go a little further. It's kind of a creeping incrementalism, and then one day the game is up.
In aviation and motor racing, they saw their tsunami, their danger wave coming. The fatal crash of the much-loved Brazilian Formula One champion Ayrton Senna in San Marino, Italy, pushed the industry to improve safety.
A number of changes were undertaken, both looking at the car design, but also looking at track design. They literally took this as a systems approach.
When Dale Earnhardt hit the wall at 155 miles an hour, he became the 4th death in 1 year. NASCAR had broken through its safety net, and the Car of the Future program led to entirely new race car designs. Study of accidents strengthened the strands of leadership, practices, and technologies, and expanded their safety net to match the demands of speed and performance. The result? Fatalities and harm dropped dramatically.
We've always felt there's many lessons to be learned from industries outside of our own. We took a NASCAR pit crew chief to look at our operating room turnover.
And it was that very crew chief who led the Car of the Future program for NASCAR.
We brought him in with fresh eyes to look at our operating room procedures and turnover time, and got great suggestions and ideas and observations that we may not have seen.
Pete Conrad dreamed of flying to new heights. On the Apollo 12 mission, he became the third man to walk on the moon.
Fantastic! Man, that may have been a small one for Neil, but that's a long one for me.
After a lifetime of pushing the limits, Pete Conrad died at a small rural hospital after a low-speed motorcycle accident.
There he was, riding a bomb, 240,000 miles from Earth, and he's safe. And he goes to a hospital where safety should be a given, and it's not. And so I think that we need to take a really serious look and get this solved. It's just inexcusable what's going on.
Dr. Jim Bajan has a terrific background as an engineer, physician, and astronaut. He was involved in the investigation of both Challenger and Columbia space shuttle accidents.
What were the lessons we learned from those two accidents?
Communication is probably the single biggest factor in any accident. Usually there's someone or some piece of information that's available that, had the decision makers been privy to it, would have known what to do. And in both those accidents, the people that knew certain information, somehow it did not get communicated to the people that needed to know it. In healthcare, it's no different. We see that often information is available, but the practitioner might not have it at the right time, and the patient suffers the consequences.
Yeah, it was a bird strike. Can I get him in for runway 1?
Runway 1, that's good.
Cactus 1529, turn right 280, you can land runway 1 at Teterboro.
We can't do it.
Sully Sullenberger successfully landed the airliner on the Hudson, saving the lives of 155 passengers and crew through leadership, safe practices, and technology.
We had a clear dialogue with concise vocabularies. We had teams trained to consistently apply these procedures that were able to build upon that, use what we did know to solve in 208 seconds a life-threatening problem we'd never seen before.
Okay, which runway would you like at Teterboro?
We're going to be in the Hudson.
I remember when Dennis Quaid and I first met you, you said, as I reflect back on that experience, there were 3 things I know I did, and I did right. Tell me about them.
Well, first I forced calm on myself, a kind of professional calm that we learned to summon up somewhere from within us. The second thing I did was I imposed order on what might have been chaos. And finally, because I knew that the time was so short and the workload so intense, well, I chose to do only the highest priority items, but do them very, very well. And then I had the discipline to ignore everything else as being only distractions. About 20 years ago, the Boeing Airplane Company did a study and projected into the future as the number of airplanes and passengers increased, how many accidents we would have if we did not lower our accident rate. We had to take action.
The industry took action.
The Boeing study and the CAST initiative that followed were so pivotal in so many different ways, because what they were really was a gigantic slap in the face that good enough wasn't in fact going to be good enough for very long. This study said if we expand as we think we're going to worldwide, we're not going to have an aviation industry because nobody will trust it. That got everybody seriously focused on something that is absolutely pivotal for medicine, and that is the belief, the real belief that we can get to zero. Because guess what? We've done that. It was an incredible example of the whole industry coming together, working together across the lines, and creating something that had never been created before.
Most consumers are shocked that we don't have an NTSB for healthcare.
I found people have been astounded, as was I originally, when I found out there was no particular body to help assimilate all the information on things that had gone terribly wrong. I'm incredibly excited that the Institute of Medicine has, in effect, endorsed the idea of a medical version of the National Transportation Safety Board, because I know how incredibly important that was for us in aviation and in all forms of transportation. It will do exactly the same thing for medicine, a complete watershed from the way we have been in the past.
In June of 2010, leaders from aviation, aerospace, government, healthcare, and the media assembled to bring best practices from aviation to healthcare, including an NTSB for hospital accidents. But while at that meeting, Dennis reminded us of what is really important.
Along that road that we're on, chasing zero in this race, is that to remember that it happens one little soul at a time. That's what makes it personal, and that's what makes people really care, is that personal connection.
In the 80s, our research showed that high performers focused on technology, but technology alone was not enough. So in the 90s, the very best adopted safe practices enabled by technology with terrific impact. But in the following decade, the real magic was found in leadership, engaged leadership. The intersection of technology, safe practices, and leadership is the sweet spot of high performance. High performance begins with leadership, ends with leadership, is all about leadership. The big surprise was where we found the greatest leadership. First was the military.
When you hear the sound of any jet's engines, that is the sound of freedom. Every person that has ever served in the United States Navy, Marine Corps, Armed Forces in general, it's kind of instilled in their DNA.
The Blue Angels train from within. The jet pilots are brand new every 2 years, and the entire team is replaced every 3 years.
We can take any sailor marine and teach them how to be a Blue Angel, because the system, the process, we take great sailors and make them even better. And we teach them how to work as a team and how to represent the Navy and the Marine Corps, but we can do it for anyone.
There's an infinite number of scenarios that might unfold operationally that you just can't train for. So what we have is an invisible safety net that helps deliver both reliability and safety.
How important is trust?
I always think of the 3 pillars of teamwork being some element of sacrifice, some element of communication, but the biggest element is trust, especially on our team. You know, I'm one of the few pilots on the planet that doesn't actually pre-flight my own airplane. I go out to my airplane for an air show. I trust that my crew chief and my first air mech have gone over that aircraft with a fine-tooth comb. When they shake my hand and they say, "Boss, this jet's ready to go," I know that they mean it.
It's not only made me a better man, but it's made me a better team player. It's improved me in so many different ways, and it's immeasurable. I can't even explain it.
Another surprise, measured in lives saved, was a national organ donorship initiative that began with the courage of Dr. Howard Koh.
Public health has such an incredible mix of science and humanity and spirituality. And in the area of organ donation, this is an area where people are making extraordinary gifts of humanity, where one person's sacrifice is another person's salvation. And it reminds you that fundamentally we are all interdependent and we're all interconnected, and we can all help one another in great times of need.
And the success was expanded nationally by one of our greatest social entrepreneurs, Dennis Wagner, a public servant, who has led successful programs through 3 administrations, proving that excellence in government is nonpartisan.
My hope for 3 years from now is that we will look back on this point in time and we will say we have been a major force and a trustworthy partner in the transformation of American healthcare. That our system is delivering better health for more people at lower costs, and they're getting the quality of care that they want.
When Don Berwick was the leader of the Institute for Healthcare Improvement, he and his team drove patient safety all over the world.
It's just wonderful to see the spread of these methods and tools and to see the wide application that they have. On the other hand, I'm still impatient that we don't have them used every patient, every place, every time.
We got more involvement and more enthusiasm and more buoyancy in the pursuit of healthcare improvement than I had experienced in my entire career.
He later served a short 17 months as Medicare's leader, facing enormous partisan opposition. However, during his tenure, he dealt a fatal blow to the status quo by building teams like the Partnership for Patients, which is ending needless harm and waste. The third surprise was in manufacturing. The Barry-Wehmiller Company has had extraordinary performance by any metric. They're driven by a visionary leader, Bob Chapman, who is dedicated to the fulfillment of his employees.
When you create an environment where people can feel valued, trusted, safe, that they engage these experiences together, and we see in them things that we never thought were possible. It allows us to see the beauty in every human being, ordinary people that do extraordinary things.
You know what? They care. It's not like punch in, do your job, and go home. It was like, no, let's help you do your job so you can feel better when you go home.
We've paid people for their hands for years, and they would have given us their heads and their hearts for free if we had just known how to ask them.
So the common denominator we found in the military, government, and manufacturing were that they practice the 4 T's of leadership: truth, trust, teamwork, and training. They engage the head with the currency of truth, the facts, figures, and science of what they do. They engage the heart with trust, building hope and joy by developing their gifts, moving the hands to the action of teamwork using the best performance methods. And they give voice to their people through training from within, by their people, for their people.
We can make the hospital safer. We can provide much better care to our patients. We just have to roll up our sleeves and do it.
So who have rolled up their sleeves, building new invisible strands of technology, practices, and leadership? Who are the role models? First, technology. An international superstar in patient safety and health information technology, Dr. David Bates is as passionate about patient safety as he is birdwatching.
How would you feel if you're getting on an airplane and you look to the left and you saw that there were no instruments on the panel? Well, that really is what it's like when a doctor sits down with a blank piece of paper in a hospital and writes an order for a drug or a test. We need to computerize ordering, and that can make things substantially safer.
Dr. Bates is the founder and leader of the Brigham and Women's Center for Patient Safety. His early findings using computers in healthcare redirected the entire marketplace. He is the leader of R&D at the World Health Organization and a leading researcher in sensing systems, barcoding, and computerized decision support. He's also one of the authors of the 2012 Institute of Medicine Health Information Technology Report. He is a pioneer in the safe adoption and verification of electronic medical records and computerized prescriber order entry systems, or CPOE.
The CPOE flight simulator is a wonderful new innovation that allows us to measure the safety and effectiveness of complex computer systems at the patient level in hospitals.
There's no question that simulation is the future in everything from surgical operations to the use of sophisticated devices to actually making sure that the computerized order entry system works as we expected it to.
You know, health information technology is not plug and play. The CPOE flight simulator verifies performance, and that's what we need.
Technology is a tool. It will not solve our problems by itself. But if we have the right leadership and vision in place, if we have identified the practices that need to be adopted and implemented, then technology can be crucial to making more progress more rapidly for more people.
The Ascension Health System proved to be a great role model for taking safe practices to scale when they were inspired to eliminate needless death and needless harm from their hospitals by a young mother who told the story of losing her daughter.
Josie was 18 months old. She loved to dance and had just learned to bounce on the trampoline with her older siblings, Jack, Relly, and Eva. She had just learned to say, "I love you." Josie was admitted to Johns Hopkins after suffering first and second degree burns from climbing into a hot bath. She died in our arms on a snowy night in what's considered to be one of the best hospitals in the world. Our lives were shattered and changed forever. Josie died from severe dehydration and misused narcotics. Careless human errors. On top of our overwhelming sorrow and intense grief, we were consumed by anger. I am not asking for your pity. I'm asking for your help. I do not know the answers. I only know that there is a problem that must be solved.
I'll never forget the first time I heard the Josie King story. I was choking back tears, and I was absolutely speechless. It had an enormous impact not only on me, but on every clinical leader who was present in the room that day, and there were over 200 of us. It was unbelievable. It galvanized everyone in the room to commit to eliminating preventable death and injury. That helped that whole strategy to evolve. It was a profound moment for me as well as all the other clinical leaders in Ascension Health.
Every senior executive in attendance that day was given a clock that counted down to July 1, 2008, the date of their goal to eliminate preventable death and injury.
It is personal because in the final analysis, those people who are dying are our friends, our families, our community members. We underestimated what could be done. The number of lives saved in our system was over 5,000 lives. That is unbelievable.
I will never forget videotaping Dr. Sandy Tolchin as he shared the moment when he watched the videotape and they were contemplating a 5-year program for no needless death, no needless harm at Ascension Health.
I know for a fact it's saving lives. It makes me feel really good, and it makes me think that things happen for a reason. And it makes me just kind of realize that this is how it was meant to be.
Because of the courage and the deep commitment of Josie's mom, Sorrel, and her whole family, that story is now known and carried all over the world. And I have seen boards of trustees and tough senior executives and proud senior physicians change their minds, turn their hearts towards safety in a way they never have before, just by hearing that story and then connecting to it and saying, oh my God, that could happen here too.
The next innovation in breakthrough healthcare performance may not be software, pharmaceuticals, or even new procedures. It is leadership that can unlock the potential of people.
Do you believe it's possible that we can bring joy back to the caregivers' lives in our healthcare system?
Oh, absolutely right, you know. And the opportunity to help others isn't just between the professional and the patient, but the professional and other professionals, helping every one of them to become better people.
This is very hard when prestigious schools like Harvard and other great schools have taught the tools of being an extractologist, how to extract the most amount of financial wealth from a system over the shortest period of time, to some degree robs us of the opportunity of investing in the joy that can occur with sustainability and the joy that people can have on the job. Is that an unfair statement?
No, you're exactly right. And it's not consistent within ourselves, because our people will look at renewable energy and say, you don't want to just suck out a one-time opportunity to use that energy from the earth. We got to bring it from renewable sources. And yet we'll look at our people and say, we'll just use them, as opposed to it's renewable. And in fact, if what you're trying to do in managing your company is make better people, not just make the products, the products that you make and the profitability you create is a byproduct of making other people better.
Maybe there's a leader that creates the systemness of an organization that creates a set of circumstances for people to have fulfillment and joy in their work, and that contagious joy might have impact as a collective intelligence of an organization. Is that possible?
The causality of happiness is focusing your energy on helping other people be better people, rather than focusing on ourselves. If what you're trying to do in managing your company is make better people, the products that you make and the profitability you create is a byproduct of making other people better, then it can create a business organization that is not like anything that we have seen before.
People like Bob Chapman want to bring leadership principles from other industries to healthcare, such as his vision for healthcare, loved ones caring for loved ones.
You ready to change the world? Absolutely. You ready for this?
Loved ones caring for loved ones is a radical vision statement.
It seems radical, but it clearly is so natural. If we're not caring for the very precious human beings that are delivering that care, how are we ever going to allow the patients to experience our goal of compassionate and safe care when they're under our stewardship?
Our great leaders are cross-pollinating best practices between aviation, manufacturing, and frontline hospitals because it's the right thing to do. Ann Rhodes, author of Built on Values, has brought leadership best practices to hospitals.
A great leader pulls those words and those values that are on the wall off the wall, and they literally live them and breathe them every time they touch a patient or a caregiver in the organization. Every single caregiver and every single patient sees what the values of the organization are by watching the behaviors of the leaders.
When I saw the value that you could generate in improving people's lives, giving them a better life or extending their life, the satisfaction you get from doing that is so great that it's driven me to make this my life work.
We measure our success by the way we touch the lives of people.
I just love it. It's like a woohoo!
In the spirit of advanced leadership concepts pioneered at Harvard through some of our greatest educators, we can train tomorrow's leaders today by instilling the 4 T's of leadership through fellowship programs, online training, and webinars that can engage the heads, hearts, hands, and voice to drive patient-centered, value-driven care that can move us from harm to healing and waste to value. Even trustees are getting certified in leadership. The World Health Organization has developed a curriculum to improve healthcare all over the world.
Where WHO is strongest is not in telling countries and telling people what to do, but in giving them tools to do it themselves. And so training young doctors and young nurses and other allied health professionals is really where you start to see the sustainability of patient safety getting advanced.
So what is an example of where trustees and leadership teams can weigh in on quality and safety? Short answer, imaging.
The Greenlight Group of leading hospitals is learning how to improve overuse, underuse, and misuse of imaging so that they can greenlight wise investments in quality. Blind budget cuts could sever the very safety net protecting patients. Major societies are already taking a stand to help caregivers and consumers make the right choices in care.
You and I have talked about the fact that imaging really is the tip of the spear to get healthcare to use electronic healthcare records.
Well, imaging is so important because, first of all, it transcends virtually all the spectrum of practices in terms of family practice, primary care, specialist care. So they see and interact with the entire medical community.
CT scanners, often called CAT scanners, created pictures of virtual slices through the body, allowing precise position of disease and winning the Nobel Prize in 1979. EMI, the investor in the Beatles, was the original investor in CAT scanning. Who would have guessed that the massive profits from the Beatles' 1960s hits would have brought to us one of the most life-saving technologies of all time? One of the first clinical scanners was installed at the Mayo Clinic.
CT has been wonderful for patient care. It has saved countless lives. It has made countless lives better because CT can look inside and find out what's going on without a scalpel. But there's an opportunity to make it even better. There are a number of exams that we don't need because we already have an exam, or we could use an ultrasound and MR instead. And by reducing exams we don't need to have done, we can save money. That's good for our country, and it's good for those patients.
Annually, there are more than 80 million CT scans in the U.S. and over 240 million worldwide, making everyone aware of radiation safety. Completely independent experts disagree on the exact amount of radiation that can cause harm. However, all agree that the lifetime dose of radiation should be tracked and minimized. All agree that patients should receive the benefits of imaging if properly selected and performed to diagnose and care for illness.
It's very different. With a new CT, we have a very good visualization, but also we reduce the dose. At the beginning, the radiation dose is more than 16 millisievert. And now with the new CT is only 2-3 millisievert.
We deal with members in all 50 states, and we have 35 million lives under contract.
Dr. David Sofa of American Imaging Management works with healthcare purchasers in the United States, advising caregivers and patients to make diagnostic imaging more appropriate and safer.
We had a real surprise about 3 years ago. We became aware of the fact that 90% of the people who were ordering the tests were doing so less than 1 time per week.
So the majority of doctors ordering these high-tech studies can't possibly understand the indications for all of them without support.
It's very hard for a general radiologist to keep up, much less the average family practitioner or internist. The sentinel effect is when we know that people are watching, we behave differently. All of us slow down when we pass a police car. The sentinel effect can have a very significant reduction in imaging, and it's not unusual for us to see imaging decrease by some 20 to 30%, simply because somebody is asking, what is it exactly you want to order, and why do you want to order it?
The 5 Rights of Imaging program is a free framework developed for the public with global experts that helps make sure that the right study with the right order performed the right way, generating the right report drives the right action for every single patient every day. It embodies the priorities of radiology organizations focused on radiation safety. So as we talk about the 5 Rights of Imaging, what do consumers need to know?
It's wonderful to have the right study. We often don't pick the right test, and duplication of tests are enormous in terms of expense. Given how much information a physician has to work with, it's actually not surprising that we miss orders so often. They really need the ability to have a checklist to be able to look and figure out what is the best test right now for this patient in this circumstance. Patients and consumers know a lot more about what's entailed now, particularly with the low-dose technology, and they're asking for it more, and I think it's important that we begin to actually are responsive to their needs. Getting the clinician the information that he or she needs when the time is most appropriate, when they're seeing that patient, that makes a huge, huge difference. The actions that we take after a test are critical, and often we fail to connect all the dots. The good provision of services, the good delivery of medical care should be well informed, and having all the information that you need to make the right action with the appropriate amount of information is essential.
So that when the patient returns to the doctor and reviews the results of the imaging studies, hopefully it will inform which direction are we going. Is this a disease that needs aggressive intervention? Is it a disease that can be watched? And hopefully the imaging test helps to answer that question.
An article, a free checklist, and smartphone application provide a guide to consumers and caregivers of the 5 rights.
It's extremely important. I think we know the variation in the use of imaging technology is still tremendous. And to have approaches that use evidence-based information to select the proper test and perform it the proper way would provide enormous dividends. And again, provide the right care at the right place at the right price.
There will never be a more exciting time in healthcare than today. That is, get on board, help change the world. We can save money and improve quality at the same time, and use those savings to help pay for infrastructure that we need so badly in healthcare. And that's really our job. And I think to energize people is to say, this is the unique time. This is a unique time, and it's not going to happen 3 months from now, 6 months from now, 9 months from now. It starts today. So get on board. It's going to be fun.
A new area for the Greenlight Group is pain management, an important focus since pain is the #1 reason people go to see the doctor.
When it comes to pain management, everyone owns it and no one owns it. And very few of us use the tools that are available, and therefore patients suffer. Because I've practiced as a surgical oncologist, anesthesiologist, and in pain management, I've seen the fragmentation in our healthcare system. And it spells disaster for many patients, but it represents a huge opportunity for improvement.
It is past time for people to take a stand. We've got to take a stand. All teach, all learn is a concept that has to apply to every board and every C-suite in America.
The no outcome, no income tsunami will hit all of us. Our children, our parents, our families. Surfers will make things happen, swimmers will watch what happens, and sinkers will wonder what happened. The new heroes of healthcare will be in the boardroom. The board of the past, who just worked with the CEO, will now work with everyone in patient safety and quality.
You'll be like Sully Sullenberger, impose a calm, put a structure on chaos, and prioritize their actions. Our hospital leaders must replace fear with hope and sustain it through faith in them and their cause. Trustees, donors, doctors, pharmacists, and our families have to take a stand and support them, or they will not survive.
It's exciting to know that this is almost like a new chapter in your life, isn't it?
Yes, definitely.
In May of 2011, Eric Kropp and Chris Jerry came together in an incredible moment of forgiveness.
Chris, I want you to meet Eric Kropp.
Hi.
Sir.
Good to see you. You too.
This healing that can occur is the kind of healing that everyone needs. And
Yeah.
so often we don't have an opportunity for this.
I know it was a mistake, buddy. Yeah. I do. Thank you. I know that in my heart. And I want you to move on with your life. Thank you. But I want you to know that I forgive you from the bottom of my heart. And I know that's what Emily would want me to do. Thank you. Emily wants us both to move on. Thank you. And make some good come out of this.
I hope that something comes good out of this.
A lot of things good will come out of it.
That day, they began a journey to save lives together through Emily's story. You know, it's all about forgiveness of budgets, plans, and accidents of the past. Forgiveness and healing are about the mind, body, spirit connection.
My grandfathers are ministers, and they cared for the spirit. My father was a surgeon. He cared for the body. I'm a psychologist, cared for the mind and the spirit. And in some level, this is a coming together of all those things and saying that people aren't just bodies when they're sick. They're mind, body, spirits. And if you don't have your mind and your body working together to heal yourself, it's much, much harder to get there.
In any leadership situation, you've got to determine what is the main goal we're all aligned around, and it can bring people together so that everyone feels that sense of passion of let's just build a great organization here that can treat patients, that can help people find full health and lead fuller lives.
The boardroom is ground zero, not the bedside. The tools of success are the 4 T's of leadership: truth, trust, teamwork, and training. Great trustees are taking a stand by declaring, I own the safety net.
There are 2 questions that I think is very important that boards and senior leadership can answer. One, is this a safe place to give and receive care? And 2, is this an environment where employees and staff can speak up and tell the truth? The follow-up question is, how do you know? If you can't answer this question, and if you don't have detection mechanisms in place, and you're not regularly monitoring and measuring these questions, you cannot improve care.
Trustees are really concerned about doing a good job, and every bit of training that can be offered to us not only helps decrease our concerns, but help us better govern the hospital.
We have to work a lot smarter.
Our greatest CEOs are taking a stand.
Not give us. Number 1, listen to the frontline people. They've got the ideas. Number 2, our job as leaders is to take away the barriers so they can implement those ideas. And number 3, it's the values that we have to demonstrate that drive the organization.
Now, many CEOs ask me, how do you manage your board? And I look at them like, what are you talking about? We don't manage our board, we embrace our board.
The people who are working at the bedside have brilliant and wonderful ideas as to how to really redesign the process of care. And if we look at the environments that we have, we've made them unduly complex and difficult for people to function in. If we help them to help those areas become simplified, our ability to do no harm increases remarkably.
The right thing is clearly twofold. One, we have to make a more efficient delivery system. And two, we got to drive quality. And I don't care what the scenario is, our patients and the country win doing those two things.
Our very greatest will embrace Bob Chapman's vision for healthcare of loved ones caring for loved ones, and deserve to ask for the heads and hearts, not just the hands. Care of the caregiver is the responsibility of the board to declare, the CEO and team to assure, and the managers to execute. We have great role models.
So, simple question. Did you commit this error on purpose? When the nurse says no, I say, well, then it's my fault. Because, of course, errors stem from system flaws. And if I'm the leader of nursing practice, I'm the person responsible for creating safe systems.
Loved ones caring for loved ones is a fabulous concept. And you know, it sounds touchy-feely, but it speaks to the core of caring for the people who give care and then improving outcomes of patients who get that care. If we don't deliver quality and safety, we will not be in the patient care business. We are not about volume anymore.
Even CFOs are going beyond the numbers, and philanthropy is changing.
As a philanthropist myself, I believe that philanthropy today in hospitals is very, very important. The way we give is changing. And what's going to be more important now is that we support the changes that are going on in our communities and that we support programs and things that hospitals are going to be able to add.
Patient Family Advisory Councils don't happen everywhere, but they should. I see a change in the compact between a patient and provider. We're moving from a provider-centric model where I tell you what to do to a partnership model where we work together to solve the problem. And just hearing that pragmatically, you know it's going to work. And seeing it in action is incredibly gratifying. I mean, it honestly is breathtaking to see.
Medical schools like the University of California at Irvine are embracing cutting-edge technology. They provided the entire curriculum to incoming medical students on iPads.
So Dr. Fox, if something happens in your home, how would you even know which hospital is the right fit for the emergency you're trying to solve?
That's a great question. I mean, time is critical with emergencies, for sure.
Moms and even dads are becoming more active in their family's care by reaching out to healthcare leaders and becoming educated through the TMIT National Care Moms Program.
Go for the people who will be so grateful for your support. Find out what they need and organize your community to make sure that they get it.
Put your name on a safety initiative, not just a building, like the Patient Safety Center at the Brigham. These are gifts that can keep giving. Start a Pay It Forward program. The Josie King video has saved thousands of lives, one life for every $60 invested.
This is our chance to step up and be the leaders and the advocates for the patients. That's why we went into medicine. We went into medicine because we cared about our fellow man. And the way that we're going to be able to make that real is be involved in creating safe environments, collaborative environments, and the kind of thing that we're going to be proud to be part of.
Patients are getting more complex. Another horizon we have to address. As you look at the increased complexity, we need to remember the basics. One of my themes always is stick with the basics.
The Keystone Project saved lives. We spread it around the country, saving tens of thousands of lives. These infections across the U.S. have been reduced by 60%, and we've taken the program now to Spain, England, and Peru, all with similar results.
It's a continual struggle to make sure that we're communicating, and medicine is so complex that the teams change all the time. The players change, the providers change, the patient's family changes. This is an ever-vigilant process.
Hospital leaders need a step-by-step roadmap to follow. The National Quality Forum's Safe Practices for Better Healthcare provide such a roadmap. They are consensus-driven, evidence-based, and have been synchronized across the major quality, safety, and purchasing organizations.
Get involved.
Make sure that you understand that their job to you as a consumer is to ensure your safety in a healthcare institution. They are your representation to the leadership of the hospital, and so make sure that you engage with them, that you hold them accountable, and they'll hold the organization accountable for these safe practices as well.
Leadership is critical. They have the ability to make things happen. A good leader will always recognize a patient and family as a productive member of the team and add them to that team.
Hospital leaders and board members have a terrific opportunity to engage their local quality improvement organizations, QIOs, who are charged to bring patients into the boardroom. They can partner with their great state hospital associations.
I am an artist. I am a mom. I'm a Cub Scout den leader and a Cub Scout Cub master.
Patients like Regina Holliday are using community engagement and social media to change the face of healthcare. Her passion for painting tells her story and stories of others.
Storytelling is so powerful in healthcare. There is a pool of people that can be activated to change absolutely everything within medicine.
Regina was a driving force behind SpeakerLink.org, a website linking patient speakers and seekers to bring the patient voice to the boardroom and quality programs.
We bring so much to the table. It's one of the most wonderful ways to come up with solutions and innovations.
Great leaders listen with heart and soul. They have empathy and compassion, an attitude that's upbeat and courageous. They dare to dream big. They're effective, they're resilient. They have a sense of purpose. They have great humility and humor. They have integrity, great ideas, wild imagination, and adhere to their principles.
Great hospitals are like a good surfer. They'll create a platform like a surfboard, match the speed and direction of the wave through teamwork. Their communities will leverage the power of the wave, not just to survive, but to thrive. They'll make things happen. But it's time to take a stand now.
Trustees and caregivers should get trained in leadership. All of us should be with our loved ones at the hospital to be part of the care team. And everyone should contact your local hospital and give resources or time to their safety programs.
This movie and toolbox are free. They're yours. If you take a stand now, you start your journey. It's not just business as usual. This is personal. You can't allow another mom, another dad, another child, another caregiver to slip through your safety net. They're in your hands because you are the safety net. Now you know. Our kids are counting on it, like this little one who just happens to be mine.
It happens one little soul at a time.